Good evening. Nurses working under the Gauteng Health Department contract following the COVID-19 pandemic haven't been paid for the past 3 months. They say they are still expected to report for duty. They have called on Gauteng Premier Panyaza Lesufi to employ them through the recent provincial recruitment campaign.
Londiwe Mkhwanazi is facing the prospect of being evicted and her car repossessed. This as she has failed to pay rent and other commitments for almost 3 months. She struggles to make ends meet and relies on Good Samaritans for support. Mkhwanazi is among some of the nurses at the Dr. George Mukhari Hospital and other health institutions in the province who haven't been paid since signing their employment contracts in April this year.
I can't afford to buy food for my parents because I'm the breadwinner at home. I'm the only one who's working. So I couldn't even pay my daughter's school fees and other 2 kids for my siblings. They're also not going to school. I don't have food. I don't have electricity. I don't have petrol, and I didn't even pay for my car, my house. From now on, if this month, on the end of this month, I have to go and live in the street because they will chase me out.
Mkhwanazi's colleagues at the Dr. George Mukhari Hospital in Garankuwa feel betrayed and exploited. They say they worked at the height of the COVID-19 pandemic only to be overlooked when permanent posts were advertised.
I can't even afford to come to work every day. Hence, they want us to be productive at work. We cannot be productive while we are starving.
We are given reasons that the reason we cannot be paid is because we are not appointed. We do not have posts.
On the 16th of June, Panyaza Lesufi posted many posts. What about us, Rona, people who have been working here? We've been here since 2020. Nothing is happening to us.
The Health Department has since said it was disappointed at the Provincial Budget Committee's decision to reduce the COVID-19 compensation of employees' budget from 1.1 billion in the 2022-2023 financial year to 600 million. Offenses Timo, SABC News, Garankuwa.
And to unpack this issue for us, we are now joined by Jack Bloom from the Gauteng Democratic Alliance. He is the Shadow MEC for the Health Department here in Gauteng. Jack Bloom, thank you so much for joining us here on the late edition. Of course, if you can just tell us, why have workers not been paid? What are you hearing from your colleagues in the Gauteng Health Department?
Well, it's not the only instance of people who are hired under COVID conditions. They were called COVID contract workers. And there's been a number of other hospitals where exactly the same thing has happened. So here we have 200 nurses at George Mukhari Hospital really suffering. They haven't been paid for 2.5 months. Can you imagine, any one of us if we hadn't been paid for that long? And it's just a general incompetence, I have to say, in the Gauteng Health Department. As I said, it has occurred at other hospitals as well, precisely with the same category of people who were hired at the height of the COVID epidemic. Remember, people were highly stressed and we needed health workers, and they performed very valuable function, and now they're not getting paid with some very poor excuses. I think it's just highlights how badly run the Gauteng Health Department is and the effect it has on workers, which also impacts on patients as well, because people can't give it their best if they haven't been paid.
And Mr. Bloom, were workers informed that they wouldn't be paid for the past 2 months, or was this just a surprise, when they were expecting payment and nothing came through?
Well, I'm sure it was a surprise. I mean, if you work, you expect to get paid. It's just, it's illegal, it's immoral, it's inhuman. People work and they expect to be paid. It's only with the Gauteng Health Department where we had several instances at other hospitals as well, where people aren't paid. I really think that the excuses are wearing very thin. And it's time they fixed up their payment processes and finalized these contracts and give people permanent posts. We keep hearing about how understaffed our hospitals are, and here we've got people who are already working and they're not being paid. Why are they not given permanent positions and and do their jobs to help patients at this hospital and other hospitals where they've got the same problem.
And Mr. Bloom, you're saying that these workers continue to be given senseless excuses in terms of why they have not been paid. If you can just indulge us and just let us know, what are those excuses workers are being given for non-payment of their salaries?
Well, they claim that, there's a Department of e-governance, which essentially is linked to the Gauteng Treasury, and they're not being able to process the payments because of, they're originally COVID contract workers, and they've got some poor excuse about how difficult it is to put them on the permanent payroll. Now, we've heard this at other hospitals as well. I mean, it really, I think it amounts to thousands of staff, not just nurses at this particular hospital. We've got other hospitals where a whole lot of categories of people haven't been paid. So I think people are tired of this. So I think they really need to know that emergency action is being taken to pay people on time. And you can't let people go on like this where they're stressed and they're not meeting their bills, and cars are being repossessed, and it's just an intolerable situation that shouldn't be allowed to continue. And of course the Premier, he's very vocal about providing jobs. He's absolutely silent on this in this particular case.
And talking about the Premier, as the opposition, Mr. Bloom, did you alert the Premier to this issue? What is he saying to you as the opposition in the legislature?
Well, the Gauteng Premier on Youth Day, he made a big flourish of advertising all the open posts. But I mean, I just find this completely hypocritical, because the Gauteng Health Department has long been known to be full of incompetence and corruption, and he's had very little to say about the Gauteng Health Department and about all the massive vacancies. Meanwhile, I think it's just a PR move, when the reality is that his provincial government can't pay existing staff their salaries. So, I just think that they need to meet their existing commitments before making promises about thousands of new jobs, which simply aren't there, to be honest.
And Mr. Bloom, does the Gauteng department have the capacity? Because, I mean, we are hearing, some of these workers are saying that, why don't we become integrated and be employed on a permanent basis in the Gauteng Health Department? Does it have the capacity to actually take these workers on board?
Well, can I tell you that there was a 2.5 billion rand went unspent in the previous year's budget. So this is a department that's chronically not able to spend their full budget. And quite frankly, when you see the massive corruption that at the Tembisa Hospital alone, the SIU found that about 1 billion rand was misspent. I mean, surely that money could go to paying staff salaries, fixing up hospitals, fixing up equipment. So I really think that this department, if they were run properly and got rid of the corruption and all the stealing, could pay workers on time. But it just hasn't happened, despite many promises over the years.
All right, Jack Bloom, thank you so much for your time here on the Late Edition. That is Jack Bloom from the DA here in Gauteng, just giving us a bit of insight in terms of those workers in the Gauteng Health Department who say they have not been paid.